Hello everybody, my name is Dr. Robbins and I'm a board certified child and adolescent psychiatrist that practices here in Hollywood, Florida. And the video that I'm going to be today is going to be about ADHD and some of the misconceptions that people have related to the disorder. The first misconception that is often brought to my attention is the question as to whether or not ADHD can be diagnosed with a single test. And the answer to this question is no. Yes, there are psychological tests that specifically look at attention and to see whether or not someone has problems with their attention. However, making the diagnosis of ADHD is not done solely with a test on inattention. In order to accurately make the diagnosis, you need to have a full clinical assessment where each of the domains of ADHD, the inattention, hyperactivity, and impulsivity symptoms are assessed, the different areas that they are happening, different settings, home, school, work, and the impact that they're having on the person. Another important part of making the accurate diagnosis of ADHD is making sure that there's no other conditions that might be mimicking ADHD. So in short, the answer is that you cannot be accurately diagnosed with ADHD just by an inattentive test. You have to have a full clinical assessment. The second misconception that's often brought to my attention is whether or not people can grow out of ADHD. And this question is often brought to me by parents where they're wondering, is this something that the kid will just eventually outgrow? They've heard about that before. And there is some partial truth to that. What we know is that ADHD is a neurodevelopmental disorder where there's a lag in the development of the prefrontal cortex. This part of the brain continues to develop up until around the ages of 22 or 25. And people with ADHD tend to have a little bit of a delayed development of that part of the brain. And as they get older, what we see is that some of the symptoms of ADHD tend to diminish. And the ones that are specifically tend to diminish more than the others are the hyperactive and impulsive symptoms. The inattentive symptoms, a little less likely to subside. And those are the ones that tend to persist as we grow on into young adulthood and adulthood. So, in short, those are the things that tend to happen. The ADHD does not go away. Some of the symptoms diminish. The inattentive symptoms tend to stay with us. We also learn different coping skills and ways to handle our symptoms as long as we are aware of them. And it will affect you less in your day-to-day as long as you can develop these type of skills. The third misconception that is brought to my attention is parents asking whether or not their kids can have ADHD if they're able to pay attention for long periods of time to video games, iPads, TV. And the answer to that is that yes, a kid, just because they can pay attention to video games for a long period of time doesn't necessarily mean they don't have ADHD. And that arises based on a stimulus principle. And if there's a high enough stimulus and there's lights and sounds and all these things going on at once, it masks the inattentive abilities of the child. However, you take that child and you put them in a lower stimulus environment, such as school, such as doing chores around the house, those inattentive symptoms will be more apparent. So just because a kid can spend long periods of time being attentive on video games does not necessarily mean they're not suffering from ADHD. Thank you very much for tuning in to my video. I hope it was educational for you, and that you were able to learn a little bit more about ADHD and some of the misconceptions that people believe. If you have any comments, you're free to ask them below. You can also follow me at Dr. Robbins MD on Facebook, and I will have more videos to come. Thanks for tuning in.